Most men notice something unusual at some point. Things that once happened naturally begin to require more effort, more intensity, more stimulation. And yet, the response doesn't feel the same. Arousal feels weaker, less consistent, or harder to access. This didn't start suddenly. It developed slowly, over months or even years, and most men never connected it to anything specific. But a pattern may be forming in the brain, one that quietly changes how the body responds. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. In this video, I'll help you understand how repeated exposure to certain types of visual stimulation may influence sexual response, why these changes often happen without clear warning signs, and what this can mean for long-term sexual and emotional health. Sexual arousal does not begin in the body. It begins in the brain. When something triggers desire, the brain releases dopamine, a chemical that reinforces reward and motivation. Over time, the brain learns which signals reliably produce that response. In a balanced sexual life, this system remains flexible. It responds to physical touch, emotional connection, and natural sensory cues. But when one form of stimulation is repeated frequently, especially content that is intense, fast, and visually novel, the brain begins to adapt. It starts to favor that pathway. When real-life intimacy does not match the same pattern, the response may feel weaker or delayed. This process is gradual. For men in their 40s, 50s, and 60s, particularly in India where stress, long working hours, and limited personal time are common, this kind of conditioning can develop quietly over years without obvious symptoms. One important change involves dopamine signaling itself. Repeated exposure to strong visual stimulation can cause the brain to associate arousal primarily with that specific input. Real intimacy, which is slower and emotionally grounded, may no longer trigger the same chemical response. This is not a moral issue. It is a neurological adaptation. The brain has learned a pattern, and it now expects that pattern to feel arousal. Many men don't notice this shift because it happens gradually. Desire may still be present during visual stimulation, but responsiveness during physical intimacy declines. Most men assume the cause is stress, aging, or fatigue, without realizing the arousal system has been quietly reconditioned. Over time, tolerance can also develop. What once felt stimulating may no longer produce the same response. As a result, some men seek stronger or more novel content to achieve the same level of arousal. This escalation is not about preference or personality. It reflects the brain's need for higher stimulation to release the same amount of dopamine. This reduced sensitivity does not stay limited to visual content. It can carry over into real-world intimacy, where normal touch, presence, and connection feel less stimulating than they once did. Some men also notice changes in erectile response. Erections may occur easily during visual stimulation, but become inconsistent or difficult during real intimacy. This pattern is sometimes referred to as arousal-based erectile difficulty. It differs from erectile dysfunction caused by blood flow or hormonal issues. In this case, the brain does not generate a strong enough arousal signal unless the learned visual cues are present. This can be confusing and distressing. Many men worry something is physically wrong and seek medication without understanding that the issue lies in how arousal has been conditioned. Emotional connection during intimacy may also begin to change. Sexual intimacy involves presence, emotional engagement, and responsiveness to another person. When arousal becomes strongly linked to visual content that removes emotional context, real intimacy may feel less satisfying. Men may be physically present but mentally distracted, relying on imagined images rather than connection with their partner. This disconnect often develops slowly and is rarely recognized until relationship satisfaction declines. Another factor is secrecy and shame. Many men feel uncomfortable discussing their use of visual sexual content, especially when they sense it may be affecting their relationships or self-control. They keep it private. This silence creates psychological stress, which itself can interfere with sexual response. In India, where open conversations about sexuality are often limited, this isolation can be even stronger. Without awareness or discussion, patterns continue unchecked. If you recognize any of these experiences, it does not mean something is permanently wrong. These changes represent adaptation, not damage. The brain remains flexible throughout life. With awareness, intentional changes, and healthier patterns of stimulation, arousal pathways can shift again. Many men experience some degree of this conditioning in modern life. Understanding what is happening is often the first step toward improvement. Every body is different. Sexual function is influenced by many factors, including hormones, circulation, sleep, stress, mental health, and relationship dynamics. The patterns described here are common but not exclusive. This content is educational and does not replace medical evaluation. If you experience persistent difficulties with arousal, erections, or sexual satisfaction, a qualified doctor can help assess whether the cause is psychological, physical, or a combination of both. So let me ask you something to reflect on. Have you noticed a difference between how your body responds to visual stimulation and how it responds during real intimacy? If this explanation helped you understand something you may have been quietly wondering about, feel free to share your thoughts in the comments. And if you want to continue learning about your body in a clear, respectful way, consider subscribing. In the next video, I'll explain how stress and sleep deprivation can quietly affect testosterone levels and sexual drive in men over 40, a connection many men overlook until the effects become impossible to ignore.